Welcome to the Captivate Standard. I'm your host, Ireland Walker. This is the podcast that's setting the bar in all things aesthetics and wellness treatments in Central New York. Let's get into it. Welcome back, everyone, to the Captivate Standard Podcast. I'm so happy you're here for this episode, number 6. It's definitely a special one. I'm joined here by Srisha Eshleman, one of Captivate's newest members. She will be a PA for us. She'll be an injector, working on the slim weight loss program, the longevity program. How are you doing?
I'm great. I'm excited to be here.
I want to know more about you, both professionally and personally. Can you tell us just a little bit about yourself, just a brief introduction?
Yeah. So I moved here from Nashville in July, so I'm still pretty new. I have been in the aesthetics industry for almost 4 years. I was doing it in Nashville prior to this. And then before that was in Chicago and worked in head and neck surgery.
Okay.
But yeah, I'm excited to be in in Syracuse.
Yes. So you'll be in Skinny Atlas and in DeWitt, is that right?
Yes. Yeah.
Okay.
Yep.
And this area is vastly different, I feel like, from Nashville. Can you talk about the differences you've seen so far, and how long have you been here?
I guess probably like almost 6 months.
Okay.
It's different. I mean, Nashville was like a really big city, and we lived kind of like downtown, close to the city.
Mm-hmm.
And here we live in Skinny Atlas, which definitely a little bit slower, small town, but we love it. It's been really good. My husband's from there, so that's what brought us back here.
Awesome.
But yeah, just a change of pace. I think like I'm getting, situated, getting into a routine. The snow,
oh my gosh,
I don't like.
Yes, it's new for you.
Yeah, not my thing. But otherwise, summer was amazing. It was nice to not be like 100 degrees and dying outside. So definitely like summer's here more. But the snow is going to be an adjustment for me. I've like ordered my winter coats.
The boots.
I missed the boot memo. I did show up today in my sneakers, which was a miss.
Yes. So cold feet, wet feet.
Yes. So I'm learning, but it's been really good.
So then as far as aesthetics goes, I think there is a big difference between what's going on here and then what's going on over there. Do you want to speak to that a little bit if you think there is a difference?
I think yes and no. I mean, I think Nashville was a lot more saturated with injectors in general. So you had to be really careful about, you should always be really careful about where you're going. Do your research on your injector before you just go. Don't go deal hunting, things like that. But I mean, if anything, I would say maybe Nashville's just like a little bit ahead of the trends just because it is a bigger city. But both places, I feel like in general in the aesthetics world, everyone's kind of going towards like natural regenerative medicine, wanting more natural results. And that's really what we focused on at my old practice as well. So from that to here, I would say is very similar. A lot of the treatments that we offer there, same ones here. So like in that aspect, I wouldn't say it's that different. Maybe the patient population is a little bit different. I mean, there it was, I think you got like a lot more like people right out of college, things like that. So that has been a little different, but for the most part, I wouldn't say it's like crazy different.
So can you talk about your education now? Did you always want to be a PA and go into this whole realm in aesthetics, or was this something that was new?
Weirdly enough, so I did my undergrad at Purdue University, and when I started there, I actually started out as pre-dental. Thought I wanted to be a dentist and love dentists. No hate to them, but I shadowed my dentist and realized this is not for me. So second semester of my freshman year, I switched to pre-PA. I didn't know specifically like what field I wanted to go into at all, but I went to PA school at Northwestern in Chicago, and our second year of school is all clinical based. So you do like 8 core electives in, everything that you can think of, like peds, surgery, ER, primary care, things like that. And then you get to pick 4 electives. So I kind of started to tailor that towards what I was interested in. Dermatology was one of them. Head and neck surgery was another. I actually graduated like right as COVID was hitting. So it definitely like limited me, I think, in terms of full job spectrum because a lot of specialties weren't hiring at the time. Right. But luckily I ended up at a great position. I worked in head and neck surgery, and it was where I had rotated as a student. And that is kind of where I feel like I started pivoting into the aesthetics world. So like essentially our department was half head and neck surgery, I guess a third head and neck surgery, a third regular ear, nose, and throat, and then a third facial plastics. And I did like all head and neck cancers. So one of my surgeons would remove all the cancers, and then the other two would use like skin from your leg and tissue from your leg and put it on your face to like it's called a flap, but that's basically like where we removed the cancer, we would then cover it with skin from other areas. And that's kind of where we started to get into like aesthetics and cosmetics, and we would team up with facial plastics a lot. And that really piqued my interest in it for sure. And then when we moved to Nashville, I started looking at like facial plastics, plastic surgery, and then just like general aesthetics, kind of like similar to Captivate, and ended up at an office in Nashville called Complexion. And that's where I was the past 3.5, almost 4 years. And it was so similar to here. I mean, all cosmetics based, women owned, and I just loved it. And like now I could never do anything else. Like I have found my niche. I love it. I know I love it. I can't see myself going anywhere else, but that's kind of my like long roundabout way of how I got there.
Your path.
Yeah.
So what about injectables? Talk to me about your style. I know you're going to be working very closely with Christina, who has her own style. She was in the previous episode. We talked all about it, but this is something where you can kind of create your own niche within it. Talk about your experience with that.
Yeah, I will say I am definitely in that realm of natural results. I am a very light-handed injector, and honestly pride myself on it. I mean, I have no problem saying no. I'm not going to let you look overdone. At the end of the day, well, one, I mean, of course I genuinely care about my patients. I don't want them to look crazy. Also, they're walking around town and it's a representation of my work too. So I will gladly tell someone no, because I myself try and be very natural in my treatments and want that for my patients as well. So I would say I do a lot of combination of, you know, your regular run-of-the-mill Botox fillers, things like that. But then I combine a lot of it with more regenerative medicine. So things like Sculptra, PRF, PRP, like things like that.
Yeah.
And then especially focusing on your skin health. So good, regular, consistent skincare, microneedling, lasers, kind of playing into all of those, so that you've got a combination of both. Because don't get me wrong, I love Botox, I love fillers. There is a place for it. But I think what I realized is that you can kind of use all of it and get someone a really great result.
What is your most favorite thing to do or treatment to do on somebody?
Sculptra, by far. Yeah, okay. I love it. I just feel like it's such a great way to get your body to stimulate collagen. It gives you some subtle volume. I think everyone can benefit from it. It gives you a really great glow. So yeah, I mean, I love Sculptra. I love a lot of things, but that's my number one.
Okay. And then is there a place on the face or body that you like to work on the most?
I mean, I love doing lips. I will say too, I really love doing the chin. I feel like it's an understated area that people kind of forget about, but it can make a really big difference on someone's face. It can, like, a little bit of chin projection, and filling in some of that chin shadowing that we start to get as we age can make a huge difference. And I feel like everyone wants like a nice defined jawline.
Jawline, yes.
And a chin is kind of a sneaky way to get that too. So I do love a chin. Yeah.
What keeps you in aesthetics? I know you were talking about, you know, you love to do the different services, but what else about it? Because there is so many other places and things you could be doing with medicine.
Yeah. I mean, one top of it is probably that, like, the industry is always changing. You can always learn. You can always grow as an injector. You can learn from everybody around you. And I love that. I mean, I like that it's not just like cookie cutter. This is what you do. This is what you prescribe. Like, for each person, it can change. And over the years, it changes. There's different trends. I think it's really important to stay on top of the trends, but also to know, like, what's fleeting and what really will give your patients good results. So I think it does take, actually, I feel like on the outside, it probably looks like it's all like glitz and glam and things like that, but there's a lot of research and things behind it that you have to stay up on, that I think is really cool. I think it's a great combination of medicine and procedure based, which I love. Like I love doing the two. And I just like that every day is different, honestly. Yeah. Like I can't have the same thing every single day.
And then you can get to know patients and
100%.
everything like that.
Yeah. Like half of the fun in my day, honestly, is like talking to my patients. I feel like they become your friends.
They do.
Yes. And so it's like so fun to know what's going on in everyone's life, like keeping up with everything. And you don't get that as much in hospital medicine because, you know, one, your appointments have to be a lot quicker. And you're just getting to know someone on a different level. A lot of times when they see you in like the hospital, they're not feeling good.
Yeah.
And so I love that. I mean, I love that every single day at work is fun, and it's fun to be around the people you work with. It's fun to be with your patients. That goes a long way. Like a really healthy work life is important.
Makes everything better.
Yeah.
Can you share some more things about yourself that you like to do beyond working? I know there's the work-life balance is so important.
Yeah. I love to work out.
Okay.
So if anyone has good workout classes, let me know. I feel like movement is a really big part of my routine and really important to me. My husband and I love to travel. So I feel like we'll try and go on some trips. You know, I feel like it gets a little bit harder as we get older, but love to travel. I have a dog, a doodle. Her name is Waffles, and love her. Love taking her on walks, spending time with her, and really just hanging out with, you know, friends and family.
Yeah. What are your main goals for 6 months out or even a year here at Captivate, if you've thought about it so far?
Yeah. I mean, I would say definitely growing my patient book would be, you know, a big goal. I think a big one actually that like more long-term, especially as I grow it as an injector, I'd love to get more into like the training space, be able to train other injectors. Has always been a goal of mine. I think it's like a really great way to one, learn yourself, but share your knowledge and to make sure that, you know, there are safe injectors out there and everyone's staying up on their education. I think it's so important. And really, I think just seeing Captivate grow would be amazing. I mean, I feel like from what I can understand, it's already grown so much, but to be able to help grow it even more, you know, bring on treatments that I've loved in Nashville, I think would be really great. So just kind of helping the company itself grow would be awesome.
Yes. And then also working with the nurses here on a daily basis on Slim and the longevity program. How much knowledge do you have of that right now? I know that you're brand new.
Yeah.
But is that going to be different for you?
It is different for me. The practice that I was at, we did have it, but it wasn't something that I was as involved with.
Okay.
So definitely, you know, a new area for me to learn about. Definitely something that's really interesting. What I appreciate a lot about Captivate is that we do have, you know, the in-body scanner. So everything is done here in a really safe way. We're making sure that people are genuinely good candidates for the Slim injection. And I think that's so, so important. So yeah, I'm really excited to learn more about that, work with the nurses closely on that, and, you know, add that into my practice.
Yes. Is there any other things that you do or habits that keep you grounded and kind of like sane, I guess? Because in medicine, it can be a lot.
Yeah.
You know, there's a lot of schooling and then there's a lot of time that goes into it.
Yeah.
And seeing people back to back and anything that you do to keep you grounded.
Definitely, like I said, exercise is a huge one. Walking. I really think that, like we talked about a little bit, work-life balance is huge. And that's like another really nice part about the aesthetics industry is there's a lot more flexibility. I think you get a lot more work-life balance. And so that helps.
I want to go into some more fun questions. We can do like a rapid fire on this.
Okay.
But what is your go-to coffee order? Are you more like tea? Do you like matcha or something?
I'm trying to get myself into matcha.
Yes.
I feel like I need it to be like loaded with vanilla and honey and all the sweet things.
Yeah.
But regular coffee, I would say either a cappuccino, I'll always love. I do it with whole milk.
Okay, I don't judge.
Or an iced vanilla latte with almond milk.
Okay.
Actually. So those are my two go-to, but yeah, I'm trying to get into the matcha world.
Are you a night person or morning person? Maybe that plays into your routine of like,
I know. I was like,
your job,
definitely a night owl, actually.
Oh,
yeah.
Okay.
Like love to stay up late, but do not bother me in the morning.
Yeah.
I just cannot with the morning. So yeah, I would say night owl for sure.
Is there any places in this area that you've taken a liking to, like any coffee shops or restaurants or anything that you have found that you're like, I could get used to going here?
So we live in Skaneateles. And so I haven't like really ventured into Syracuse. I do have a running list on my phone of places that I need to try. I just haven't really gotten there yet. But I would say in Skaneateles, we love the Sherwood.
Yes.
Especially literally this morning, I was saying to my husband, like, we need to go to the Sherwood because snowy with the fire going, cozy, like that's totally my vibe.
It's so cute.
And we love Krebs. I mean, Krebs is so fun, really great food. It's great drinks. Like I feel like it's just like a fun, good vibe there. So those two, but I know I need to venture into Syracuse.
Yes. I mean, they're very different.
Yeah.
And there's so much to do. So I thought I would ask just because I know Nashville's like, go, go, go. I feel like in a big city. So
I know it's so funny though. Cause I'm like, it's not like we were like hitting the town every night, you know, like, I mean, for sure there's an amazing nightlife and stuff there, but like, I love hanging with my friends at home and like cooking dinner together. Like, I feel like I'm in that stage now.
Yeah.
But yes, I mean, there was restaurants popping up all the time. Granted, like Nashville did change a lot from when I was there till when I left. Like it grew a lot. So
yeah,
for part of the time, I mean, it was smaller and there wasn't as much stuff.
How do you unwind after a day of work? What's like your go-to thing?
I mean, I feel like I keep saying walking. I feel like a walk is huge for me. Like get home, take the dog on a walk, especially like in the winter time. Like I feel so tired sometimes when I leave work because it's dark so early. So I'm like, I really need to prioritize that. I love cooking dinner with my husband. I feel like it's just like relaxing to me, playing some music, cooking a meal, like hanging out with each other.
Yeah.
And then like a funny one, I guess, or like a guilty pleasure is like reality TV.
Same.
Love
100%.
reality TV. So
what are your go-tos for that?
Housewives, love them, Southern Charm, Summer House, you know, you name it. I feel like that is my thing. So like oddly enough, to wind down, I love to put on a reality TV show and just like be in it. Yeah. I'm like listening to them and I'm just like, okay, this is oddly relaxing for me.
Yeah. It's their problems and not yours.
Yes. And like they're like screaming at each other, but
it's relaxing.
I find it relaxing.
Yeah. Is there any skills that you wish you had that you don't have, or something that you're excited to learn here at Captivate?
Yeah. I mean, I think, like I said, I love the opportunity to always grow as an injector. So I'm really, really excited to work with Christina. I mean, and Karen, I think like they're both going to be amazing and so great to work with and learn from. And especially with Christina having so much experience in the industry, like that's an amazing way to grow. So I love watching her inject, kind of tweaking how I'm doing things, talking through things.
Yeah.
So I would say like in a way, like a new skill in that of just growing and changing. I'm super excited for.
Definitely. Okay, let's move into PRP, PRF. Those are abbreviations for terms and things. Can you talk about your knowledge and experience in those two things?
Yeah. So at the practice I was at before, we actually pretty much exclusively did PRF. So definitely a lot more familiarity with PRF and PRF Easy Gel. But I mean, the two are honestly very similar.
Yeah.
PRP stands for platelet-rich plasma and PRF stands for platelet-rich fibrin. But both are, you know, used in regenerative medicine. They're used to stimulate your body's own collagen. They help with fine lines and wrinkles, texture, under eye crepiness, hair growth, you name it. There's so many ways you can use it. So the biggest difference is a PRP like tube. When you're drawing your blood, it's going to have anticoagulants in it. And it's spun at a faster rate when we spin it in the centrifuge. That basically helps for all your red blood cells to kind of sink to the bottom and your plasma to go to the top. Okay, so PRF stands for platelet-rich fibrin. And so when you draw the tube of blood, there's no anticoagulants in it. And it's actually spun at a little bit slower of a speed. Okay. Similar thing though. So basically it'll split based off the density of the things that are in your blood. So the bottom part is going to be all your red blood cells again, and we don't use those at all. So the middle part is actually what we call your PRF, and that's what's full of your platelets, your white blood cells, and your growth factors. So like all the good things that you want to inject back in to get that collagen stimulation. And then the top part is kind of a mix of like plasma and a little bit of PRF, but it's really that middle part that's concentrated that you want.
Talk to me about some of those things. Who is the most or best candidate for something like this? Who would be interested?
Yeah, I mean, it kind of depends on what you're looking for.
Okay.
a lot of times when people are like, I've got really bad under eye hollowing or darkness, sometimes that darkness can be a combination of two things. It can, one, truly just be darkness under the eye, or it can actually be like a shadow that's basically being created from the hollowness that's under your eye. And so by using PRP, PRF to inject underneath the eye, you can stimulate that volume again and get some more volume underneath the eye to help with that shadowing, but it also does thicken up that tissue and make that under eye skin a lot healthier and help with that darkness. So some darkness that we get from under our eye is that this skin under our eye is so thin.
Yeah.
And it's one of the first places that you age because it's so thin. And so a lot of times what can happen is you've got vascularity underneath your eye. And so as that skin starts to thin out, you can almost start to see the vessels under the eye.
Mm-hmm.
And that's what kind of makes that, like, I don't know if you've seen it, like it's almost like a bluish, like dark hue under the eye. And so when we inject the PRF underneath the eye, it will literally thicken that skin again because of that collagen stimulation. And it helps so that you can't see that vascularity underneath the eye anymore. A lot of times too, when people have like those really stubborn lines that are like in here that you can't really get with Botox, PRF is a great one for it because again, it's going to stimulate that tissue. It's going to help to get some collagen there, thicken up that skin, make it a lot healthier. And it's going to help to soften those lines under the eye. There's different ways to inject it. Like you can ask, many injectors, I'm sure that, some will do it similarly, some do it differently. Yeah. But the basis of it is you draw your blood. So like as if you were going to a regular blood draw, you typically get like 1 to 2 tubes. So not that much. Okay. And then we spin it in the centrifuge and then we draw up your PRF or your PRP. I like to use a cannula to inject it. So almost think of it as like, it's not a needle. It's like a blunt tip, like noodle is how I typically describe it. It's nothing sharp by the eye or anything. So the only actual part that involves a needle is we'll do a little bit of a numbing, like a topical or an injection of numbing, which helps a ton. Like, trust me, I've had many rounds of it. You want the numbing. So we'll do a little numbing. That's obviously with an injection of numbing. It's a little poke, a little burn, and then it's over. And then the rest of it is all with that cannula. So there's nothing sharp by your eye at all. Okay. And once you get through the numbing, like I personally think the numbing is the worst part, just from like that little burn. But it's like when you go to get like a cavity filled, you know how they numb and it like burns a little bit? It's like that. But once you're numb, like you'll feel little tinges here and there, but it's really not that bad.
What about downtime? So is there redness, anything that happens?
When you inject it, you will swell. I mean, there's a little bit of just natural swelling underneath the eye. So I always tell people, give yourself like 24 to 48 hours to expect some swelling. Sometimes like within that 24-hour period, you do pretty much look swollen. Like it's almost like you had a great cry, like, you know what I mean? Where you're just like puffy, but most people wouldn't notice it. Like sometimes I'll just wear my glasses after and no one knows. But it's really that swelling underneath the eye. If you add it like topically to microneedling or lasers and things like that, it actually cuts down on your downtime because with all those regenerative properties in it, it helps to kind of heal your skin faster. So I feel like actually with microneedling, I'm not as red after when I do PRF on top of it. But when it's injected, expect some swelling for, 1 to 2 days. Of course, there's things you can do to help minimize your swelling, like, avoid alcohol before, try not to go on a flight right after, avoiding exercise within that 24 to 48 hour period. Those are all really big ways to help. And icing, Yeah.
What do you think is the goal of someone wanting to do this service or treatment? To look a little bit younger, look more natural, just soften things? Or is this going to have a dramatic effect on someone's face?
Yeah, I wouldn't say dramatic. Like it's definitely more of a subtle treatment. So it honestly depends on your patient. Like if you've got someone coming in that doesn't really have that much volume loss, but they kind of just want to like look a little bit more awake or look a little bit brighter, you could totally just go straight with PRF and get them a great result. You do need multiple treatments. Like just at baseline, I will say like one treatment isn't going to do it. Most people need about 2 to 3 and you space them out 4 to 6 weeks apart. Once you do your kind of round of them, the maintenance is a lot lower. Like I would say most of my patients were getting 1, maybe 2 treatments a year after they did their kind of like round of them. But that collagen stimulation does take time, and it takes a little bit to see a result. So if someone is coming in and they're like, I need an immediate result, like I want it now, I would not go PRF, because they're just not going to get that. You have to be patient with it, and you have to trust the process. And so a lot of times with them, I would lean more towards filler, or if someone has, more volume loss and you kind of need something with a little bit more oomph to it,
Yeah.
I would go filler. And then you can maintain with things like PRF or Sculptra, like more regenerative medicine. You can use those to maintain their filler so that you're not always getting filler every time.
Yeah.
Because I think a lot of times when people start to look like puffy or weird is when they're just getting like too much. They start to get like blind to their face, and they just keep putting more filler. So you can kind of use both interchangeably. It just depends on your patient and what they're looking for.
And then what about men versus women? Are you seeing that they're coming in to target different areas as opposed to what women are doing?
Men, I mean, more hair loss, I would say, like just from the get-go. But of course, then you've got women have hair loss too, and especially postpartum. So I guess but I would say like men, I definitely would see them first for hair loss, but men, I've had men get it under their eyes as well. And I've had men boost their microneedling treatment with it. Like, yeah, I wouldn't say it's like gender specific. I will say that there are things that you can do that affect the quality of your PRF. So like hydration, making sure you're really well hydrated before your appointments and like leading up to your appointment is super important for the quality of your PRF. That's where sometimes it can get a little bit dicey. Like if you're not really having a healthy lifestyle, you're not hydrated, you've had a lot of alcohol, things like that, your quality of your PRF is going to be less than someone who does do all those things. Yeah. And age does play a factor into it. So a younger person is just going to have a higher quality PRF than someone who's a little bit older. So always something to consider, especially when you're giving expectations, for what they should expect for their results. It's important to think about those things.
What would you say is the most common place that people are looking to kind of fix, I guess, if you want to put it that way? You were saying fine lines, wrinkles. Is it in between the eyebrows? Is it this over here? Is it here on the mouth?
For in between here, I would always go Botox all day. It's going to be your number one to help with that. It's more so for like, I feel like it's that person that comes in that's like, I just feel like I look tired. And I don't know why. I feel like that's like a number one, like thing in my head that goes off being like, oh, I feel like they're probably looking at their under eyes and like just feeling tired in their eyes. Mm-hmm. And you kind of do a combination. I mean, sometimes you can do a little bit of Botox to open up the eye and help them there. And that gives them more of that immediate gratification. And then you can go back in with PRF, or maybe a little bit of filler. It just, again, it depends, but definitely the most common areas to use it are underneath the eye. And like, yes, like you can do Botox for your crow's feet and that helps a ton. It's like in here when it gets crazy, like in the middle part of your eye, or when that skin just looks a little bit dull and thinner. Mm-hmm. That's a great person for it. And hair loss is a great one too.
How does the hair loss portion work as far as like stimulating the follicles?
Yes. So you're basically like, you do the whole same thing. Like you draw it up, you draw their blood, spin it, draw it up into like little 1 cc syringes. And then you use a tiny little needle and you'll inject it at the follicle. So it's not like super deep or anything, but it basically re-stimulates that follicle again to get it to produce like a thicker hair shaft. If there is a follicle that has no hair growth from it, you can't really stimulate those, but you can stimulate ones that are working and growing hair.
Okay. And then what is a standout or a really positive experience you've had with a client using PRP or PRF that you can recall that you want to share?
I mean, honestly, we could put a photo of my before and afters. It's pretty crazy.
Oh, wow. Okay.
Yeah. Like I've had regular PRF under my eyes. I've had the PRF Easy Gel. It's been a game changer for me. I mean, like my under eyes were my number one thing. I had a lot of darkness under my eyes from that shadowing that I was telling you about and just volume loss. It's just genetic. Yeah. And doing PRF has like changed my under eye. Like I feel like I used to have to do like, I would try. I don't really know much about makeup, but I would do like the color correcting and then like concealer on top. And now it's like put some concealer on, put some sunscreen on and go. And
you're good.
Like it's made such a difference for me. And like I said, I did like rounds of it because I had so much volume loss. And I did multiple rounds of it. And now my maintenance is so low. Like I probably do it once a year.
Can you talk to me about the cost of PRP and PRF?
Yeah. I mean, the aesthetics world in general is costly.
Yes,
I mean, you're
for
paying for the service and the product, the injector, all the things. So I always tell people it's easier said than done. Like, of course, I understand like wanting to save, wanting to work within a budget. We will always do that. Like I always make sure to ask people what their budget is, what they're looking at for, and make a treatment plan that makes sense based off of that. But I mean, yeah, PRP and PRF cost money. It is less than a syringe of filler. But if you think about like what you're paying for and the process that goes into it, I feel like it makes sense. And a lot of times too, I try to, talk to patients a lot about what maintenance looks like, because sometimes with these regenerative procedures, it feels like in the beginning, you're putting a lot towards it.
Yeah.
And that's when you really have to like trust the process, trust your injector, know that they have your best interest in mind, because when you're waiting for those results, it can be like, what the heck did I just pay for?
Yeah,
right? Like you're like, I don't see anything yet. But I promise you, like always, you come out on the other end and you're so thankful. And then after that, like you're just not doing it as much. You're not having to keep up with it all the time. So I always think of it as like it's an upfront investment, but then down the line, it's a lot less. Because one thing to think about too is like we stopped making our own collagen at 27. So then how can we get our body to stimulate collagen? And it's things like this, like regenerative medicine. But once you stimulate that collagen, it's yours to keep. It's not going anywhere.
Yeah.
I guess as our body like burns through it, but it's yours. So it's like, it's not like you're like going to just metabolize through it. Right. So that's another way I think of like kind of justifying the cost.
I do want to go into a portion where we do a PRP or PRF, like what one it would go towards, which scenario. But can you just highlight for me one more time the main difference between the two?
Yeah. I mean, biggest differences are anticoagulants versus none in the tube, spinning speeds. So you're going to spin PRP faster, PRP slower, and what you're drawing from it. So PRP is your plasma and PRF is your platelet-rich fibrin that has the white blood cells, platelets, growth factors, all that stuff. Both are going to be regenerative. Both are going to stimulate collagen. Both are great for just overall tissue health. But you kind of use them in different ways. Like PRP, I would probably focus more on like injecting into the hair, applying topically with microneedling, things like that. PRF, I would think more so for like your under eyes, injecting into fine lines. Acne scarring is another one. Sometimes I'll like, when I'm microneedling, like go over the acne scars, obviously with the pen, but then inject PRF into the scar as well to kind of like pop it out and stimulate some of that collagen. So, I mean, they're both very similar and you can use them interchangeably, but there's kind of like specific niches for them that I like.
Yeah.
A recent thing that's like coming into the aesthetics world is called PRF Easy Gel or PRP Gel is something that people might see. And that actually is like a little bit more of a extensive process. You still draw 2 tubes of blood, so nothing really different for the patient, but on the back end, it's a little bit more work. You spin again at different speeds, and you draw out essentially what's your albumin, or your water component of your blood, and we heat that up and it makes it into a literal gel. And then you combine it with your PRF or your PRP, and that's like the liquid portion of it. And so it gives more of a feel of like a filler. And so I have had that under my eye, and I feel like for volume, that was more dramatic.
For a patient who wants overall skin rejuvenation and already does microneedling, would it be PRF or PRP?
I guess either. I would say PRP though, to like boost to their microneedling. So you just apply it on topically afterwards.
What about someone who has acne scarring? We just talked about this, and they want the strongest collagen production possible to kind of heal and overturn that.
The PRF. I mean, and injecting it into that scar is going to be huge.
What about someone who wants minimal downtime, but fast results? They want to see the results. And I know we talked about you have to do multiple sessions, but
I know if someone's like, I need results quickly, again, I'm reaching for filler. Because I don't want to set unrealistic expectations. I don't want to be like, yeah, sure, you'll see this in 2 weeks. Because you probably will see it in 2 weeks, but then it's going to go away because your body has to stimulate collagen and it's slow. It's like a hair cycle. So it takes time. So if someone's like, I need results ASAP, I would go filler.
What about someone who wants to be glowing or have a healthy looking appearance before an event or something? Or would you advise against doing it before a big event?
I wouldn't inject it underneath your eyes close to an event. Like, for example, I did it before my wedding. I did it 2 months before my wedding because Well, I had some before, right? So I already had some of that volume and I wanted to just really boost it right before, but I didn't want any bruising. I didn't want any swelling, and I wanted that collagen to start going by the time I got to my wedding.
Yeah.
There are ways that you could do it. Like if you need it right before an event, like one thing that people will do is called aqua gold or like a micro infusion. And you numb topically for it, but you basically make like a special cocktail almost for a patient, and you can put different things in it. Like you can put a little bit of Botox in there. You can put a little bit of filler in there. It's not going to affect your muscle. It's not going to give volume to your face like a filler or Botox typically would, but use like a microscopic level like that. It can help to give your skin kind of like a porcelain glowy look. Sometimes I will have people put PRF in it too. And you stamp it into your skin. So it's half the depth of microneedling. So the downtime is a lot less and it'll kick in for your event. So that's kind of like cool. A way that you could do it before an event, really. Anything else, I guess you could microneedle and put it on top before your event, but again, I wouldn't do it like the week of your event.
Yeah.
That just feels like
too close. Maybe.
Too close. Yeah.
Cutting it close. Yeah. And then what if someone wants to combine this PRP or PRF with skincare at home? Yeah. Is there something that's better for at-home use as opposed to doing laser or doing it with microneedling with an esthetician or a professional?
You can't really do it at home. Like I wouldn't say like, let's draw your PRF and you go home with it. It's going to clot. So like, it's that would be clumsy. Like, it's not going to be the same. Yeah. It's something that should definitely be done in the office, use that day. I always tell people though, like do your skincare because it's the same thing. Like you wouldn't go to the dentist without brushing your teeth every day. Mm-hmm. You wouldn't come do all these procedures and put your money towards it if you're not doing on a daily basis what you need to be doing to keep your skin healthy. So, big things I always tell people, sunscreen every single day. Like you got to have it. Vitamin C is going to be really great in conjunction because when you're putting it as a booster for microneedling, it's going to help brighten up that skin. Vitamin C is going to do a similar. And then a retinol is a really great one. Retinol is going to increase your skin cell turnover. It helps with fine lines and wrinkles. It helps with texture. And so when you're doing like microneedling, things like that, for sure, be on a retinol at home on a day-to-day basis. Cut it before you're microneedling so you don't like freak out, but you should be doing all those things on a daily basis. I mean, I would say use them in conjunction, but I wouldn't take your PRF home.
Yeah. And like, I know some people can have their own microneedling pen
that
they do have at home. And then they could just maybe think that they could do it, but definitely would say no.
Wouldn't recommend. I'm actually very against at-home microneedling because if it's not done correctly with the correct amount of pressure or the correct amount of depth, you can really cause some damage to your skin. Like you can make little blood vessels pop up that you've broken because you're too superficial. You can cause more micro injuries to your skin. So just, let the professionals who are trained do it. It's your skin.
Yeah.
I mean,
it's important.
Yeah. I'm not doing microneedling.
Yes. Okay. I've never done that either. So a term that I feel like some people can recognize is vampire facial, and that has to do with PRP and PRF type realm. Can you talk about that?
Yeah. It's basically microneedling and then putting PRF or PRP on top of it to help boost the microneedling treatment. Okay. I feel like the term vampire facial came from like either the fact that it's your own blood, or sometimes I feel like when you Google videos of microneedling, it looks very like bloody.
Yeah. Like dripping.
Yeah. It's not like that. No, it's not like that at all. Like you might have like some pinpoint small bleeding, nothing crazy. So yeah, I feel like it just got termed that, but that's what it is. It's microneedling and then putting that on top topically.
Okay. And I feel like maybe social media played into that as well. Like younger people starting to be more proactive about skincare and doing all of these things, and they're posting about it, and then people are like surprised by.
Yeah, I know. It's such a funny term to me, but I feel like social media like blew that one up.
For sure. And then talk to me about what you would say to somebody who is hesitant or nervous to try PRP or PRF, or even just looking into it. I think you did an amazing job explaining it here, but just face to face, if someone wants to come in for a consultation, what would you say?
Yeah. I mean, I always show patients before and afters from like mine or patients that have cleared it because I think seeing that really helps. Obviously explaining the procedure, what it's going to entail. But a lot of times, honestly, when it comes up in the room, if it's coming up organically, if someone's not gung-ho ready to do it that day, I'm like, wait and think about it and take your time, do your research, like look things up on your own. Of course, don't go Google crazy, right? But like look things up, see kind of what's out there. And and take your time with it. It's a big decision. It's your face. So I obviously don't take that lightly, but I think that's the beauty of a consultation is it's like, there's so many things out there. And the point is to help you know what's best for you and what's best for your goals. But of course, there's never any pressure to get anything done. I don't ever want someone to feel uncomfortable. So if it's something that like they want to process and think about, by all means, they should.
And then when are your books officially open for people to book with you and see you and get to know you?
December 8th. So next week, I'm so excited.
Awesome.
Can't wait to see everyone and meet everyone, honestly.
Yeah. And you'll be in Skinny Atlas and DeWitt, like we mentioned earlier, just so for people, because we have
half and half. So 2 days Skinny Atlas, 2 days DeWitt.
Well, thank you so much for joining me today.
Thank you.
And we'll hopefully see you soon for another episode.
Can't wait.